Good evening, Los Angeles. Against the backdrop of COVID-19, each evening, I've spoken about how our work recognizes that every life is sacred, that each one of us has work to do to protect one another and to save lives. Only lost lives we can count, and saved ones we can never. But we know that when we do the work of saving lives, we're doing the work that we are brought to, that we are meant for, and that we are here for. Tonight, I want to talk about a sacred life before I get to my usual updates about the important information in our fight against the COVID-19 crisis. Because we saw a fellow American, George Floyd, killed before our eyes. He was killed when he should not have been. He is dead when he should be alive. He was murdered in cold blood in front of this nation. When a knee was at his neck, he said he couldn't breathe. And in his last breaths, he called out for his mama. And now he is gone. But as we know far too well, he was far from the first. The end of his life was another page in the worst chapter of our nation's history, of what it means to be Black in America 244 years into our attempts to find and to define a more perfect union. And each time this happens, we have to speak clearly. We have to say the truth. We have to stop in these moments, as painful as they are, to right the wrongs that aren't just part of our history, but that exist here in our present. Because before George Floyd felt a knee on his neck, robbing him of his breath, Eric Garner could not breathe. Because before this vile act occurred, Breonna Taylor couldn't survive a night's sleep. Ahmaud Arbery wasn't allowed to go for his daily jog. Michael Brown couldn't put his hands up, and Trayvon Martin couldn't wear a hoodie. These stories are endless, but we must find an end to them. This is our work tonight. This is our work tomorrow. This is our work for the rest of our lives. As we speak, there are Americans demonstrating in cities across the country, from our nation's capital to Minneapolis. And right here in our city, we will always stand by people's rights to express their pain and to give space to that outrage. We know how to do this, not because we're any better, but we've been through it here. In 2017, when folks were upset and wanted to protest against racism and xenophobia, against discrimination and for equal rights, we protected that right because it is the most important one we have. We know how to do this too without violence. I've been talking for the last 2 days with community leaders, with young Angelenos, and I've asked my team to do the same thing across this city, to not only protect our spaces, to yell out, but also to take the next step forward, not just in listening, but in dialoguing and demanding what we have to collectively do as a nation to make sure this death was not in vain. I've been on the phone with my fellow mayors, including Mayors Fry and Carter in Minneapolis and St. Paul. And our gang reduction and youth development workers who specialize in keeping the peace and investing in justice across our city, I've asked them to multiply these conversations so that we have a place not just to express our sadness, but to get to work. And I want to say something to every non-African American watching tonight, that this can't be a burden, that this cannot be a discussion that just African Americans are consumed with. White and Latino and Asian and Native Americans must all own this moment, and all must join this movement. We have to bring this conversation into our homes and into our workplaces, to turn inward to address discrimination in our own communities, and to unlearn it in our hearts. I share your resolve to not only declare that Black lives matter, but to make that statement real in our policies and our politics, in our policing, in our laws, and most of all, in our hearts, where all of this starts, and where one day all of this should end. We must acknowledge racism lives not just in our criminal justice system, but all around us. You're more likely to be sick, incarcerated, under or unemployed, homeless, if you're African American or in many communities of color. That's why our work is not only to demand justice for victims of police abuse, but to make community college and college affordable and free, to push for a higher minimum wage, to ensure that there is universal health care, that there is housing for people who are unhoused, lower prison populations, and more job training and placements. These are anti-racist acts. They are our weapons across decades of discrimination and centuries of segregation. I've talked in these briefings about COVID-19 about race, from the beginning when we saw Asian businesses targeted and AAPI Angelenos, the victims of hatred and even attacks. The way that immigrants were targeted and written out of federal help because they were seen as less than human and not as Americans. And later about the way that COVID-19 infects and kills Black men and women at rates higher than any other community, together with Native Hawaiians. What we face is not new. African Americans, Latinos, most people of color have worse health outcomes, are less likely to have insurance or to see a doctor when they fall ill. And we have to see this, we have to say this, and we have to do something about it. We have to understand that reality and do what Angelenos do best: speak from our heart and lead with love. So tonight, let us continue to demand justice, not just in Minneapolis, but across this country, and to walk with peace. It's what Breonna Taylor's mom said this morning after 7 people were shot last night in the unrest in Louisville. She said, I quote, "The last thing she'd want to see right now is any more violence." Let us honor the fallen. Let us push for justice. And let us march forward and march together. I know that we will. I know that we will. This has been a hard time for all of us. This week's events are the latest thing to unmoor what has been 2 months of feeling like we are unmoored. We don't know where we're at and what the future holds, but we're getting through this. Together, we're taking bold steps into this new reality. So let me turn now to where we are in our fight against COVID-19. Earlier this week, the Los Angeles County Department of Public Health released data about our county. It showed we have reduced the spread of the virus and met the state's criteria to open more businesses and activities. I know a lot of you are thinking, oh, is this just about people getting haircuts or being able to go out to a restaurant? At its heart, this is about saving lives and livelihoods, the people who work in those restaurants as much as the ones that eat there, the people who cut hair and have not had a paycheck in months. This is about what we can do to learn the lessons of living with COVID-19 and to take steps forward, urgent steps, with safety. Let me share what this data that was shared with the state says. This week, we had a 20% reduction in deaths from last week. And the last time we had this level of deaths was 6 weeks ago. I know that's not easy for anybody who's lost someone this week, but it is good news. In our testing centers, we have the lowest positive rate for our tests since we started testing. Now in the testing centers throughout the city and county, those drive-through and walk-up-to centers, about 4.5%. That's good news. Our new hospitalizations this week were lower than the week before, and lower than the week before that, and lower than the week before that. In fact, we haven't seen hospitalizations this low since it was March. I know for some we can't go too fast with the opening. For others, we can't go too slow. But I'm always guided by this data. And our data shows that our county has met the criteria to move into the advanced stages of phase 2 of the state's resilience roadmap. But the data also reminds us the virus isn't gone. Hardly. It is still here, and it is still as dangerous. And Angelenos are still dying from COVID-19 each day. But we're learning how to live safer, work safer, shop safer. We're learning that it doesn't take government to tell us to know we should stay at home whenever we can because it's safer there. And that practicing physical distancing, washing our hands, sanitizing surfaces, wearing a face covering, these are not acts of protest or impositions. They are acts of love and of protection. And they make an enormous difference. They've allowed us to take these steps forward. And that's why, starting today, restaurants, barbershops, and hair salons may reopen. At barbershops and hair salons, stylists may only serve one client at a time, and everyone must wear face coverings. Nail salons remain closed, and spa services, including massage and facials and waxing, are not permitted yet. At restaurants, outdoor seating and curbside pickup will be prioritized, and bar areas remain closed, and occupancy will be limited to 60%. And you can make the reopening process easier and safer by paying with a card, not cash, by making a reservation. And to be clear, businesses are not mandated to open. So if you're a business owner, take your time to get it right. Make sure you're safe for your customers and for your employees. And we have a lot of help for you. As I shared before, and now we've detailed more for restaurants and bars, for some of the close contact services so far are barbershops and beauty salons, that at coronavirus.lacity.org/business, we have the checklists here of what it takes to reopen, to keep you safe, the physical distancing, the requirements, and we're here to help. We're looking at ways that we can procure PPE for businesses that can't find it, to help our business ambassadors roll out if you have questions, and we'll be updating that more this coming week. But for now, go to that website, download it, and start the checklist now. And when you're ready to open, we welcome you. Every business that's reopening is still required by the county to implement the detailed public health protocols and post them. So make sure you're doing that as well. And that guidance is at the same place, coronavirus.lacity.org/business. I know a lot of people are asking too about offices, when they can get back to work. Office-based businesses may now open, but only if telework is not possible. Let me restate that. Get a lot of questions about this, and they're good questions. Now the state, a lot of people think these are just decisions we're making here in City Hall, but remember, it's the state that says what we can do, the county who says what we are allowed to do. And office-based businesses may now open, but only for those where telework is not possible. So if you can work from home, you still need to work from home. Houses of worship, as we discussed earlier this week, are now permitted to open, but they must not exceed 25% capacity or 100 people, whichever is lower. And you have to enforce physical distancing and have face coverings at all services. And my message to clergy is the same as businesses: only open when you're ready. State and county public health officials will evaluate places of worship after 21 days to ensure that the appropriate safeguards are there, because our houses of worship across this nation were some of the most dangerous places of spread early on. Choir practice, funerals, services, where we bring people together from multiple neighborhoods and then they go back to those neighborhoods. So please be safe. And tonight I can announce another step forward that is important to help us safely get back to some of our favorite restaurants, and that's LA Al Fresco. LA Al Fresco is our name for the program that encourages outdoor seating at restaurants to give more space for diners to maintain physical distance and to enjoy our amazing weather. Through LA Al Fresco, the city will offer temporary, no-cost allowances for restaurants to provide outdoor dining on sidewalks and private parking lots, and the program may expand to streets in the future. That takes a little bit more work to engineer safely. But eligible restaurants will immediately receive approval for outdoor dining, and if you're a restaurant who wants to use the street and parking spaces for dining, we want to hear from you. So submit an application expressing your interest, and we will notify you as soon as resources are made available. Restaurants in the city of Los Angeles can apply for this program at coronavirus.lacity.org/alfresco, ALFRESCO. And I want to give a special thanks to my colleagues here at Los Angeles City Hall, Council Members Bonin, Buscaino, Blumenfield, Rodriguez, and all the rest who have been working so hard on this, together with our departments of transportation, city planning, building and safety, Bureau of Engineering, and Streets LA for their support. We've been working on this for weeks, and now that we've gotten the green light from the state and county, we're really excited. I know it's hard for restaurants to make a profit at reduced capacity, but what this allows is for you to have more people, even with that reduced capacity, by expanding the capacity to sidewalks and to parking lots, and to make sure you can get the number of customers you need to make sure people keep their jobs and our restaurants can stand back up. It's clear that today we are talking about taking steps forward. But as I've said all along, this rests on us. The data and the guidance of our medical professionals is clear. We need to do everything to protect ourselves, abide by recommendations and rules so that we don't have to take any steps backwards. And with that, let me walk through the data that you need to know today. As you know, each Friday I compare to last Friday, and I shared some of the good news with you at the top of our data. But today, the county reported 1,824 new cases, bringing the total number of cases to 51,562, a 4% increase since yesterday. And that included a big backlog. We had a couple data dumps of labs that had been testing from a couple weeks ago and last week. So about 500 cases were received yesterday from one lab. A week ago today, in comparison, there was 1,072 new cases and a total of 42,849. These weekly case totals keep us sober. Last week, we added 7,027 cases. This week, 8,713 new cases. But as we expand our testing, we expect that to be one of the things we follow. The other is the positivity rate, which continues to come steadily down and is now at 4.5% at our testing facilities. The city of LA, we counted 617 new cases today, bringing our Los Angeles city total to 24,261, a 3% increase since yesterday. By comparison, last week on Friday, there was 450 new cases, and we had a total of 20,391. The worst part of this briefing every time is the number of new deaths, and we learned of 50 new deaths countywide, bringing the total to 2,290 deaths, a 2% increase from yesterday. As I mentioned, this week was less deadly than last week by about 20%, 245 deaths compared to 301 last week, and the lowest number we've had in weeks. In this past week, 111 city residents died because of this virus. And as I said, and as I always say, we grieve with every family who is grieving their loved ones. Each death was a person and a life, a universe unto themselves. We remember the names and the faces and the stories behind. Let me share one of those with you tonight. Tonight's number includes a husband and a father, a friend, colleague, and teacher named Kabwe Chanda, who died on April 8th at just 47 years of age. A reminder that it does not just kill this COVID-19, our elderly. Like so many Angelenos, Kabwe wasn't born in Los Angeles. He moved here from across the globe, where we have a sister city in the African nation of Zambia. But he found in Los Angeles, like all of us lucky enough to be born here or smart enough to come here, a home. Anyone who knew Kabwe will never forget his warm smile, his easy laugh, the kindness and positive energy he brought into any room. When you're around Kabwe, folks say his spirit was contagious. And that attitude, his graciousness, are going to be so deeply lost by his many friends at the Los Angeles Community College District, where he worked for more than 15 years, most recently as IT manager. He'll be missed by the students at the West Los Angeles College campus who benefited from his guidance. He himself studied on that campus and eventually became an adjunct instructor, teaching computer science and helping others to pursue their dreams. And above all, Kabwe defined himself by his family. He was devoted to his wife, so proud of his 15-year-old son, Noah, and his wife, Pamela, and Noah miss him so dearly. I know your loss is so profound, and we join you to wrap our arms of love around you this evening. And I speak for the City of Angels when I say how deeply sorry we are that he is not here. I wish we could bring Kabwe and everybody who has died from this back. That's impossible, of course, but this is what we can do. We can carry on with the kindness that Kabwe taught us. We can seek out opportunities to live life the way that he did, and we can continue to do everything possible to protect one another and to stop this virus that took him from us, and to make sure we can stop other families from grieving. As we gradually learn to live in this new reality, it remains critical for us to make sure that our hospitals stay below capacity. As I mentioned, we've never had as many ventilators as we have right now available. Our general emergency hospitals have nearly 1,000 beds available. As you've heard me say time and time again, we continue to aggressively scale our testing capacity. Opening our largest testing site yet in Dodger Stadium, we think the largest in the country, where anyone can schedule an appointment with or without symptoms. We have the capacity throughout LA County to test more than 25,000 people each day. And just through our testing centers alone, we've now tested more than 516,000 people. Free testing helps us address some of our most critical challenges, connecting people to treatment who are visibly sick, those who don't know they're sick and are silent spreaders, and those who may be returning to work but want the peace of mind for themselves or their employers that they are not positive. And these challenges are most acute at our skilled nursing facilities and institutional settings, where we've tragically seen more than half of all the COVID-related deaths in LA County. That's why we required every skilled nursing facility in the city to conduct testing for all residents and staffs at least once a month, to inform us of when and where it's happening, and to post it for the public. We also deployed rapid response teams made up of our firefighters to these centers. And of the 135 skilled nursing facilities in the city of Los Angeles, we have directly conducted, supported, and verified testing at 131 of those 135. And our mobile team will continue to check in regularly by phone and in person to make sure they're staying with the program and to get those last 4 in compliance. The more we test, the more we know. The more we know, the more we can do. The more we can do, the more lives we can save. So go and get tested, or help their senior nursing facility get tested, or learn where we're testing with people experiencing homelessness at coronavirus.lacity.org/testing, or just call us at 311. We're doing everything we can to save lives and to support Angelenos, on top of our work to scale testing to reach even more of our neighbors. We've now delivered Angeleno cards, $17 million worth of them, to families hit hard by this crisis. Today alone, we distributed 1,100 cards, bringing the total number of people reached close to 50,000. And we're helping renters and landlords. This week, the City of Los Angeles announced the Emergency Renter Relief Fund, a plan to allocate $100 million of our coronavirus relief funds to help our renters facing economic hardship and to pay those landlords that depend on that rent. Folks are hurting, and we are here to help. We're here to help through programs, and we're here to help with safe opening. The two things are not mutually exclusive. This dichotomy that we either have to stay closed and somehow protect us from deaths, or be open and get the economy going, we can and we must figure out ways to protect lives and get people back to work. For many in our city, this time has been marked not only by the challenges of each day, but also by the milestones that we've missed, the weddings, the graduations, the birthdays, the things that were supposed to happen that we couldn't do. And this week we've been confronted by painful new milestones, ones that we cannot miss and ones that were never supposed to happen. More than 40 million Americans are now unemployed, left without the work that keeps their family fed, that keeps them alive, and that gives them purpose. And 100,000 Americans are now gone from this earth forever, taken by the virus, stolen from the people who love them and whom they loved. Our grief is shared. It is held tight by each one of us, every household that has lost a member, carried together by every American and Angeleno in this season of loss. We are bound by more than our grief, whether it's COVID-19 or what we saw in Minneapolis. This is time to summon our best angels, to be uncompromising in what we demand for justice, for our health system, for our criminal justice system, but at the same time to be there with the love and generosity that is the only way to get through crisis. It defines who we are, and I know here that we truly are a city of angels. Let's keep working together to build that better tomorrow, that better nation, and that better place for us all. Let's not let up, and let's keep staying safe and staying healthy, and whenever we can, keep staying at home. Strength and love and justice to each one of you, Los Angeles. Thank you. With that, I'd be happy to answer questions.
We have a question from the line of Joseph Cerna with Los Angeles Times. Your line is now open.
Hi, Joseph.
Hi, Mayor Garcetti. Thanks for taking the time. Can you explain why the LA area has decided to open up so much more quickly than the San Francisco Bay Area, even though LA has a much worse case rate and death rate?
Sure. So San Francisco, I believe, is doing in 2 weeks, so it's not so much of a difference. It's 2 weeks or maybe a week and a half. I speak all the time with Mayor London Breed and the other 12 mayors of the 13 big cities in California, and I think we're all in alignment. If you're a caring person, you have to care about preventing death, and if you're a caring person, you have to care about people who are falling off the cliff economically. I would never take these steps forward recklessly. I would never take these steps forward if I thought we were going to see a huge surge into our hospitals or of our cases. I take these steps forward because the numbers show us that the deaths are down, that our hospitalizations are down, that our positivity rate of our tests is down. And it was not a decision that I make alone. In fact, it is one that the state mandates. If you can reach these thresholds, and the county submitted that because we have reached those thresholds, it is something that was permissive and submitted. Second, it's very difficult for Los Angeles not to go in concert with the counties of this region. Regions have to move together. How do you tell somebody in Long Beach who is suffering that everybody living on this block can go across the street in Orange County and get their hair cut, but you as a barber can't go back to work when there are safe ways to do that? This is not easy work. These are not easy decisions to make. And I've always said we would not do things one day earlier than we needed to or one day later than we needed to. But it is very clear. We have larger than Great Depression unemployment in Los Angeles. If we saw surging hospital bed visits, we saw fewer ventilators, if we saw our positivity rate going up or our deaths surging, I would not take these steps. But that is not the data. Those are not the numbers. Just as we did with our construction trades safely, just as we did with farmers markets when we had to close them down, reopen them safely, I keep saying we are learning more and more about how to live with this. We need to be more surgical about where the deaths are in our institutional settings. And as I just shared with our skilled nursing facilities, where I think LA City has been the leading city on enforcement and assistance for those places. And if we continue that work, I believe we can continue making strides in making health protections and economic progress together. Thanks, Joseph. I'll take the next question.
Thank you.
Our next question comes from the line of Steve Gregory with KFI News. Your line is now open.
We're learning more and more
Hey,
about
Steve.
how to live with this. We need to be more surgical
How you
about
doing,
where
Steve?
the deaths are in our institutional setting. And as I just shared,
I think we can hear the delay on the stream, but can you hear me, Steve? Go ahead.
Are you there? I'm sorry. Yeah, I heard you today on the call with the congressional subcommittee, and I wanted to find out your views and thoughts of how you felt the session went, and also if you had any comment on sort of Jim Jordan's sort of rant against you. I just wondered if you felt like that, because I was waiting to see if you were going to rebut his comments or not, and you didn't. I just want to know, you want to take this opportunity to do that?
No, when people are dying in our country, when people are economically suffering, it's incumbent. Leadership is all about bringing people together. It's about finding what unites us and not what divides us. So I will never take the bait of playing politics with something like COVID-19 in people's lives. It's just not who I am. It's not what we're about here in Los Angeles. As I said, we should summon our better angels rather than becoming a bunch of wrestling demons. We need to make sure that we are pointing out across red and blue, which is something that I hate that we caricature. I mean, I can find a governor of Ohio who happens to be a Republican doing an amazing job and not receiving the criticism of his own party for when he closed things down. I can see, blue mayors or mayors who happen to be Democrats who aren't leading as Democrats, but who have put away, like we did in Los Angeles, record amounts of money before this hit so that our reserves were strong to be able to help weather the storm. I don't have time for the politics of this. I only have time to try to serve my people and to come together with like-minded people. So I thought, that one comment aside, it was a great session. I joined together with a handful plus of mayors. I don't even know what all their political parties were, but we talked about things like how religious services spread in southwestern Oklahoma, in one of the towns that had the most deaths we've seen anywhere, Mangum, that was something we had to be very careful of. We learned in Seattle how Seattle, which had the earliest onset, has helped bring those cases down, as we're beginning to see here in Los Angeles. And most of all, what I tried to bring to this discussion, and it was Chairman Clyburn who led it, and it was great to see him and Maxine Waters, Ranking Member Scalise, and people from both parties who really said things, I thought, with a couple exceptions, with great unity, that we need federal help for our state and local governments. I told them that on June 30th, our fiscal years end for 46 states and most cities and counties in America. That is a cliff that we are staring at. And if assistance doesn't come in furthering the HEROES Act, which the House passed, and doing something in the Senate, you will see the biggest increase in unemployment come from the public sector. And we don't ask people whether they're Republicans or Democrats or independents when they work for city government. We don't ask people's party affiliations when we provide city services like picking up your trash. As I pointed out, we've got more Republicans in Southern California than in the state of Tennessee. And we don't not serve them. And in Tennessee, I hope people who happen to be Democrats can get good service from their elected representatives. Let's put that aside and let's do the necessary work of tracking and tracing, getting 100,000 to 300,000 Americans paid to do that work so we can stay open and open more. Let's get to work making sure there's testing for everybody, and cities like LA don't have to dig into their general fund and figure out a way to make sure that people have the most basic thing to know whether they're COVID-19 positive. Let's get together and do an infrastructure package to get people back to work that right now are unemployed. That seems to be what a good congressional hearing is about, and that's 99% of what I heard today. Thanks.
I just want to follow up real quick and ask what do you feel like your odds are, or the odds are for the mayors to receive that $250 billion?
I think they're good. I heard the president after the last round tweet right after that, or I saw that he tweeted, let's get states and cities done next. We have so many folks that support us across the nation in the 19,000 cities that comprise America, Republican mayors, Democratic mayors, independent mayors, and we're getting good feedback. It may not be as high as what we have in the House version, but even if it's compromised, we need that assistance right away. We need it now. We need to do that so that we don't have first responders who are on the line who face cuts, so that we don't have folks that are in our hospitals as public employees making cuts, so that we can get the contact tracers we need. I feel very optimistic, and I think by and large, besides Senate Majority Leader, who now I think is beginning to look at it, most folks have said, let's get this done across party lines.
And finally, when are we getting back to in-person press conferences? And I'll leave you with that, and I wish you a good weekend.
Thank you. I'll consult with County Public Health. This was not an individual decision. I know a couple of you have seen us at the earlier press conference this week, but hopefully it'll be soon. I miss seeing you in person. Thank you. Have a good weekend as well. Next question.
Oops, sorry.
Go ahead.
Next question comes from Claudia Pashuta with KNX News Radio. Please go ahead. Your line is open.
Hey, Claudia.
Hello. Hi. I'd like to get an update on the testing and the turnaround time on results. And also, as more things open up, as far as I know, haven't heard anything about people, getting the green light to meet up with people outside of their household. And especially with salons and barbershops reopening, do you really expect people that will continue to, stay apart? Thank you.
Sure. I hope people will. As I said, we're not going to be able to just enforce our way out of this, nor do I think we should turn into any sort of police state to do it. It requires all of us to educate ourselves. Sometimes our business ambassadors, can encourage folks, but we have to lead with our heads and with our hearts to make sure we don't endanger each other. We read, I think it was Indiana, of a couple folks who cut hair who went to work sick and spread to 140 people, 10-minute haircuts they were doing over a number of hours. Please use good judgment. Whether you're giving these services or getting these services, if you're sick, you shouldn't be there at all. With testing, I asked about that because I thought you might ask. I think we're going to get confirmed, but the lab told us in the last 24 hours that we're back to 24 to 30 hours, so there was some lag Last week, you were correct about that. We embraced that. We got on them. We said we've got to go back, and they say the backlog is gone. So moving forward, tests that people do now should be about 24-hour to 30-hour turnaround time. Sometimes that requires the overnight email being sent, but within 2 days. Thanks, Claudia. Next question.
It's from Somali Kohli with Los Angeles Times. Your line is now open.
Hi, Somali. How you doing?
Hi, that's actually Sonali Kohli.
Sonali.
The LAUSD superintendent said today in a statement and in a letter to you, Mayor, that they can't consider opening schools until city and county health authorities ensure robust testing and contact tracing plans for students and employees. Do you agree with this? And does the city have plans for testing and tracing at schools specifically?
Sure. So a couple things. First of all, we need to make sure that safely, if our numbers hold, that we do get children back to school. This is important to make sure our kids don't fall behind, and important so that parents can get back to work. That's going to be a critical thing, but we have to absolutely do that safely. So I appreciated that letter. I think most of those things, whether it's testing, tracing, tracking, are county health responsibilities, but absolutely, just as we've been here for the county, we're here for the school district and anybody else. We have made universal testing available, so teachers, administrators, staff, students, and their families today can do that throughout Los Angeles, and where we can transition that together with the county. I know the county just received over $200 million, one of only 2 local jurisdictions with New York City, to get the state allocations for testing. And I think that'll, not just in LAUSD, but across our schools, is something that would be a very appropriate use of that money so that we can safely test, safely reassure both students, their families, and staff in our schools that they can get back to school. Tracing and tracking, same thing, and we've offered actually Los Angeles City employees to our county Department of Public Health, and Dr. Ferrer is taking us up on that, and we're really proud on our dime to be able to help support the tracing and tracking of the individuals who test positive, because that's going to be critical too. And I think the last piece that was in the letter that you didn't mention was about the great work that the district is doing, not only feeding students, which they get full reimbursement for, but adults, which they just started doing. And I've connected the superintendent with FEMA. I've asked our FEMA regional director to reimburse them for at least 75% of those adult feeding needs, just as they're doing with us for our seniors, and as we're doing with our people with disabilities. We're all carrying those costs. County, local government, state, and the school district deserves that sort of reimbursement as well. So I look forward to helping the county and the school district however possible, but I want to end where we started. We do need to, as long as we can do it safely, get our schools back open, get people back to school if our numbers hold, and we are here to help in any way they need. Thank you.
Does the city have any plans to take responsibility for any testing that will happen specifically on campuses or for students, or as part of a plan to reopen schools beyond what's already offered?
Sure. We don't. The district has a budget just as we have a budget. They're both incredibly taxed. But the county, which overlaps for both of us, as I mentioned, has gotten an infusion of money for testing, and the state has gotten $500 million on top of that as well. I hope that they prioritize that in our schools, and we're more than happy. We're working with the county about what are the next steps for testing. We're more than happy to transition what we've been doing and hand that over so that we can figure out a way that schools get tested and workplaces too, which is going to be critical. Good news today too, CVS is moving forward, I think in 30-something sites here in the county for people to be able to do that and get that paid through insurance. But there's no question at our schools we should have that. As I said, it's not our jurisdiction to do that. We don't have a health department, but we are here to help a health department. And as we've been doing by offering tests to anybody in the county, not even who have to live in the city of LA, whether they have symptoms or not, I think we've shown how we can step up and help. Thank you. Next question, please.
Next question is from the line of Erica Martin with KTLA. Your line is now open.
Hi, Erica.
Hey there. You had previously said that parking enforcement was relaxed through June 1st. Is that going to be extended any further?
Yes, it'll be extended for 1 more month. So that will go to July 1st, and we'll look at it during the next month as well. Absolutely. Even though there's more opening, we're still recommending people stay at home. It's safer at home. If folks can telework from home, we want to continue encouraging that to help stop the spread of COVID-19, allow people to be able to work from there and not get punished because they're doing the right thing. Thanks, Erica. Next question.
Next question is from the line of Robert Kovacic with NBC. Please go ahead.
Robert, how are you?
How are you? I'm well, sir. I'm going to make this quick because we've got to turn this around for the 6th.
Yep.
Mayor Garcetti, how quickly are you prepared as you watch the numbers come back to pull back and say, okay, we need to stop these reopenings and we're going to have to make closures? Would you do it immediately or would be a gradual process? And then second question, as LA now takes to the street this evening, and when I'm looking at protesters right now from our news chopper, guidance tonight for the LAPD and what you would say to those taking to the streets tonight in LA.
I would say we're going to protect your rights to protest. Don't violate any laws in doing that, but we absolutely need as a nation, certainly as a city, to voice our outrage. It's our patriotic duty to not only stand up for George Floyd, but for everybody who has been killed unnecessarily, who's been murdered, for the structural racism that we have in our country. We will protect you, but I want to make sure people protect themselves and each other. 7 people shot in Louisville last night. That doesn't do anything to put things forward. It's not what those dead who we are speaking out for would want. Let's honor their memories. Let's do this in a peaceful way. And like I said, I'm very confident LAPD has a lot of experience, has a lot of scars, but because of that, is a much better department and knows how to do this well, to protect the rights of everybody, to be able to voice that and protect our city from any of the worst examples we've seen around the country. In terms of the first one, do you want to address the first one? Or do you have another one?
The second question regarding whether we pull back.
Yeah, exactly.
How quickly we will be ready to pull back.
So, we follow the data usually ahead of time. So I'd be surprised if we have to pull back quickly ever. We'll see this happening before it happens. Long before we see deaths go up, we'll see hospital admissions go up. And before hospital admissions go up, we track even the symptoms that people are saying they have when they call helplines with some of our medical systems, whether it's Kaiser or some of our other medical systems. So we know long ahead, hopefully at those moments when we say, hey, there's a lot more people calling in, everybody, we've got to be better about making sure we're physically distancing, washing our hands, making sure our workplaces and restaurants and everything else doing well. We should be able to give people warnings long before, hopefully self-correct for them. So I would be very surprised if ever on a dime we have to step backwards. But should something radical happen, and it happens within a day or two, flu season comes, we see the weather change, something happens, of course, just as we did at the beginning of this, we will save lives. We're not going to let masses of people die. But I'm confident that done the right way, so far what we're learning, we won't have to ever do that on a dime. Thanks, Robert. I'm told that that was the last question, so thank you all very much. I'm going to speak in Spanish as I do each evening, and I know because of what's happening both around this country and with COVID-19, it'll be a little bit longer. But please, be safe, call for justice, make sure your voices are heard. Please keep caring for each other this weekend. Do the right things with the new opportunities that we have. I know some of you will be out at restaurants and others will be finally getting that haircut that you've been waiting a long time for, but let's all do it responsibly and keep saving lives. Muy buenas tardes, Los Ángeles. Hoy quisiera hablar de un tema que ha afectado a tantos por todo el país. Nosotros fuimos testigos del asesinato de George Floyd, pero como todos sabemos, él no fue el primero. Su muerte es una más entre tantas otras, parte de un legado de odio e intolerancia que ha herido el alma de nuestro país. Los angelinos deben hacer lo que dicte su conciencia en respuesta a este dolor y horror. Y siempre apoyaré esfuerzos para expresar su indignación y alzar sus voces. Le he pedido a nuestra policía que permita ese espacio y espero que sean cuidadosos con su respuesta para que todos puedan manifestarse de manera segura. Y tenemos que tener un diálogo con todas las comunidades, no solamente afroamericano, pero blanca, latina, asiática, para entender y enfrentar la discriminación en nuestras propias comunidades y tomar acción compasiva y liderar siempre con amor. Estos son nuestros derechos y nuestras responsabilidades. Este es un día muy triste en los Estados Unidos, pero estamos unidos y somos unidos en Los Ángeles para la justicia y con el amor y no violencia. Aunque hemos visto datos que indican que reducimos la propagación del virus y que logramos los criterios para abrir más negocios y actividades, el riesgo del virus sigue presente y la gente sigue muriendo de este virus cada día. Pero estamos aprendiendo cómo vivir con este virus, llevar coberturas faciales, lavarnos las manos, mantener la sana distancia. Y por eso podemos avanzar un poco más hoy. Efectivo inmediatamente, restaurantes, barberos y peluqueros pueden reanudar sus operaciones. En los salones de peluquería y los barberos solo pueden atender a un cliente a la vez y todos deben llevar coberturas faciales. Siguen cerrados los salones de uñas y servicios de spa, incluyendo masaje, faciales y depilación de cera. Para restaurantes será prioridad ofrecer comedores al aire libre o ordenar para llevar, y se limita al 60% de la ocupación. Los bares siguen cerrados. Estos negocios no están obligados a abrir inmediatamente. Si necesita más tiempo para prepararse, tómelo. Todos los negocios tienen que cumplir con los protocolos de salud del condado y estos protocolos están en la página coronavirus.lacity.org/business. Estas guías para operaciones seguras son muy importantes por los empleados y los dueños de estos negocios. Muchos se están preguntando cuándo pueden regresar a la oficina también. Negocios con oficinas pueden abrir de nuevo, pero solamente si no es posible el teletrabajo. Centros religiosos también pueden abrir de nuevo, pero no deben exceder el 25% de su capacidad, o 100 personas, lo que sea menos. Deben mantener la sana distancia y llevar coberturas faciales. Y esta noche también puedo anunciar otro paso adelante importante, el programa LE al Fresco. Este programa ofrece permisos temporales para que restaurantes puedan más fácilmente ofrecer comedores al aire libre para sus clientes. Restaurantes elegibles recibirán aprobación para utilizar estacionamientos y aceras del Departamento de Transporte lo más pronto posible. Y restaurantes deben visitar la página coronavirus.lacity.org/al-fresco para aplicar por estos permisos temporales. Ahora les comparto los datos de hoy. Hoy hubieron 1,824 nuevos casos en el condado de Los Ángeles, llegando a un total de 51,562. En la ciudad tuvimos 617 nuevos casos, llegando a un total de 24,261. Y hoy supimos del fallecimiento de 50 personas más en el condado, llegando a un total ahora de 2,290 muertes. Y oramos con todos quienes han perdido un ser querido a este virus. En estos hospitales tenemos 995 camas disponibles. Entre ellas, 169 están en las unidades de cuidados intensivos y tenemos 1,300 respiradores disponibles, un récord. Estos datos son muy importantes. Menos muertos, menos casos positivos. Tenemos un porciento ahora solamente de 4,5% positivo en las pruebas de coronavirus. Y también más camas, más respiradores. Estos son muy importantes en nuestros pasos adelante en Los Ángeles. Las pruebas nos ayudan a salvar vidas. Estas pruebas son más importantes en centros de cuidados especializados donde hemos visto más de la mitad de muertes por COVID-19 en el condado. Por eso requerimos que estos lugares hagan pruebas a todos sus residentes y empleados una vez al mes y desplegamos a equipos de respuesta rápida para hacer estas pruebas a lugares con casos de COVID-19. Estos equipos han hecho, apoyado y verificado pruebas en 131 de los 135 centros en Los Ángeles, salvando las vidas de nuestras personas de tercera edad y los empleados en estos lugares también. Y hoy tenemos la capacidad de hacerle pruebas a casi 25,000 personas cada día, incluyendo al estadio de los Dodgers. Para el final de hoy hemos hecho pruebas a 516,000 personas. Hágase la prueba aunque tengan síntomas o no, es gratis. Y para hacer una cita, visita la página coronavirus.lacity.org/testing o al 311 después de 5. Esto ha sido una semana muy difícil para nuestra nación y continuaremos a luchar contra el coronavirus aquí en Los Ángeles. Hemos perdido más de 100,000 almas en los Estados Unidos a este virus. Pero nuestro dolor nos une. Sigamos trabajando juntos para hacer un futuro mejor. No paren, sigan cuidándose. Quédense protegidos y quédense en buena salud. Y quédense para ahora en casa. Fuerza y amor y justicia, Los Ángeles. Gracias. Thank you.